we are out today on the beautiful campus of the VA Medical Center to tell you about a very special week ahead. Quite an adventure. We have Jay Zimmerman here with us and his service dog, Bo. Jay, thanks for meeting us out here today.
Thanks, nice to be here.
Well, you have come up with just quite the journey next week, a literal trek to raise awareness of a very important cause. Sort of tell me a little bit about what you're going to be doing.
May is Mental Health Awareness Month, and we were kind of trying to figure out a way that we could raise awareness about mental health and start a conversation really kind of outside of the medical center environment. And so we were thinking, you know, how do we get into the community where people live? Something we used to do in the Army, we do Ruck Marches. For people that aren't familiar with that, you know, it's just basically an uncomfortable military backpack loaded down with gear, and you move from point A to point B. So tossed out this idea of doing a Ruck March through the areas that we here at Mountain Home serve. So starting next week on Monday, Bo and I are going to leave here from the VA, and we're going to do a Ruck March from Mountain Home, leaving Monday morning and ending up Friday in Gatlinburg.
Carrying this, you said it's kind of like this uncomfortable backpack that you're going to be sort of marching, all to really raise awareness and to bring people in. This cause, I would imagine, so important to you as a veteran to reach out and help other veterans.
Yeah, it's super important to me on a host of levels. You know, I've had friends since I got out of the service that you know, have passed from suicide. You know, have had my own struggles where I've felt, you know, like there was no way out. Fortunately, that's somewhere that I've been able to work through and get out of those places. But felt the need to come to work in suicide prevention a couple of years ago. And been very blessed to spend the last couple of years going out into the community and educating people about suicide and just trying to get rid of some of the stigma that comes along with, you know, not only mental health, but, you know, individuals that struggle with thoughts of wanting to harm themselves or in their life. And, you know, this was a good way and a good opportunity for us to do that by again, you know, not waiting for people to come to us to ask questions. Sometimes it's hard to do. You know, people feel hopeless and helpless and out of opportunities to come and talk to us. So we're basically taking the opportunity to them. You know, along the way, we're going to have a town hall meeting every day where we encourage folks to come out, talk to us, ask questions. Obviously, working for the Office of Mental Health and Suicide Prevention, you know, that is one of our main focuses. But we're going to have other resources there about the VA, so if people have questions about the VA in general, we're going to be able to answer some of those questions too, help people link with resources, maybe find a sense of community that they've not had in the past. So, you know, it's very personal and very close to home for me.
And I would imagine too, Jay, as you're doing this, making this difference, the fact that you can really relate and you can be honest and sincere and sort of share your story, how impactful is that to the folks that you're working with?
The ability to reach out to somebody, to talk to somebody and say, you know, I've been where you're at. Mm-hmm. I truly understand. You know, and not to say that I know the answers to your problems, because my problems may not be exactly what your problems are, but just to know that somebody's been in a similar situation, and if nothing else, I don't know the answers, but at least I maybe know the roadmap that will lead us out of this dark spot. I think that is something that is unique to the position that I'm in, and it's one of the reasons that I've stayed in the position that I'm in for the last 15 years.
Well, and certainly an incredibly important mission that you have ahead. Thanks so much for taking the time to share with us. We'll give all of our viewers, first of all, some of the stops. As he mentioned, those town hall meetings taking place throughout the week. These are some of those stops along the way. And also, we want to encourage you to follow their journey. It is Jay and Bo, hashtag Jay and Bo, and you can visit the Facebook page for the VA Mountain Home, and they can help you direct so you can take part in this important journey as well.
And we want to wish Jay good luck on his walk. And if you're a veteran and you feel like you need to talk with someone about any issue in your life, please call the Veterans Crisis Line at 1-800-273-8255 and press 1, or go to veteranscrisisline.net.